Now in physio, we talk about a lot of effects that are less mechanical than you think. You know, it used to be said that, you know, if you've got a muscle that's tight, you know, you need to just really beat it into submission. And if you've got a joint that is stiff, you've got to mobilize it so it moves. So you've got to mechanically force the movement. And what we started to realize that these things don't work in that way. Things are more neurologically driven. The analogy I use with a lot of patients is that it's like if you want to get a horse to move. The old-fashioned idea is that you've got to push the horse, and that's going to be hard work. And if that horse doesn't want to move, you're not going to be able to move it. And it's the same with the human body. Whereas the actual effect we're driving a lot of the time is neurological, which is like with the horse dangling a carrot in front of its nose so the horse walks for you. And not a lot of effort is required therefore. And this has been shown in multiple research papers where the thought process about what we thought was happening by doing a particular mobilization wasn't actually achieving the thing we were looking for, or wasn't creating the effect we were looking for. It got the positive outcome we were looking for, so they got less pain, they moved better, but we didn't necessarily create the movements. We almost affected the pain levels and the nervous system responded, and then we got basically a reduction in pain, reduction in spasm, and movement came with. And this is what was interesting. There was a research paper done here where they looked at foam rolling and they looked at massage. And what they did is they did it where the problem wasn't. So they were looking at basically pain on pressure, so pressure pain scores. And they were seeing if it reduced pressure pain in the area that was foam rolled, or in an area that wasn't even foam rolled, so as a before and after. And lo and behold, what did they find? As I've already alluded to, they found that in the limb that they did not even massage, and in the limb that they did not even do a foam roll on, they found that that limb that wasn't treated also reduced pain on pressure, right? So this highlights that the effect is neurological, and the effect is also broad neurological. So meaning it affects a big part of the body. It could be on that spinal level to bilateral sides, maybe, but certainly that would indicate that. It could be global to the whole body. So you could even say, would that mean if you did it from lower limb to upper body on a different spinal level, you might get a reduction in pain as well? And I would say that there's a good chance that's the case. So what it highlights is that, you know, you do treatments on a patient thinking it has to be in the area where the problem is, and it doesn't. This is really interesting, not because it's just interesting, but because say you get a patient in where the area itself is agonizingly painful to touch, to press, to move, to stretch, whatever, right? You as a physio naturally have been trained to think we need to get into that area, or we need to focus something to that area, but the patient may not tolerate that. Now it seems a bit weird to the patient, but you could say, I'm just going to massage your back, right? If it was a knee problem, and they'd be thinking, why are you massaging me back? But then the knee pain would reduce based on what we found in the research. And there has been other studies that have found this exact case study I'm talking about there, where they massaged the back and they found the knee pain reduced. It seems weird, but it is a good way of thinking about it, because if you can't massage the knee as an example, and you make it worse, well, that's no good to anybody. You're trying to reduce the pain to enable the person to be able to move better, function better, and start to do their exercises to progress. And if you can't do that in the session, then the session is no good to you. And it may be detrimental by trying to do too much. But what this means is you can work somewhere else in the body and affect the other area, whether it be through foam rolling in this case, or massage, or whatever. But it shows you that you can work away from the site and affect the site. So this is again showing that the effects on the body are not always as mechanical and localized as we think. They are much broader. And again, it highlighting the body is an interesting thing, and it's not what we originally thought it was. So anyway, that's it for this video, and I'll see you next time.